Good afternoon. My name is Deshauna Taylor. I'm completing this hand washing technique videotape for N5309 Teaching Learning Strategies in partial fulfillment at UT of Arlington College of Nursing with lead instructor Dr. Wendy Barr. Today I really want to talk to you about the importance of hand washing and what we can do to prevent hospital-acquired or healthcare-acquired infections, also known as nosocomial infections. But first I want to introduce you to a friend of mine. Hello and good afternoon. I'm the Foam Ranger. Welcome to all you new hospital transporters. I'm here to talk to you about hand washing and hand hygiene and the importance it is to us. I know you probably thought I was the hamburger helper guy, but I'm not. I'm the Foam Ranger. And I'm here to talk to you about what you want to do before you make that hamburger helper and why it's so important. So, hand washing is our first line of defense. Studies have shown from the World Health Organization that 5 to 10% of the people that are admitted for an acute reason to the hospital end up with some type of either healthcare acquired infection or nosocomial infection, as some of us know it as. This infection can actually be detrimental, and it can be dangerous not only to the patient, but it can be dangerous to you too. So that's why the Foam Ranger is here to teach you how to correctly wash your hands. And I want you to be aware of what our policy here at this institution states and how you need to hand wash and make sure you have good hand hygiene. First, to be able to do this, I need to take off my hands. So some of the reasons that you would actually wash your hands is anytime before you touch the patient, anytime after you've touched the patient or come in contact with anything in the room. As you're transporting the patient down the hallway, you want to make sure that your hands are clean before you touch that wheelchair. You want to make sure you wash your hands even after you've touched that wheelchair. Any type of treatment that's done on the patient, you want to make sure you have good clean hands. You can either hand wash or you can actually foam. You can hand wash and then 7 times you're able to use the foam. After that 7th time, then you need to go back to doing the hand wash. The only time that you can't use foam is if a patient that has Clostridium difficile. At that point in time, the alcohol foam does not work on that type of illness. Therefore, you need to wash your hands for those types of patients. Also, you need to make sure that you keep your fingernails short. There are to be no fake nails. Prior to washing your hands, you need to take off any jewelry that you have, any rings or anything like that, and pull your sleeves up so that you can get a good amount of the area wet. So turn the water on to the temperature that is most comfortable for you. Doesn't matter if it's hot or if it's cold, that's not what works. What works is the soap and the friction and the soap together. So we're going to turn the water on here. Get a little bit of the soap in your hand. Kind of moisten your hand a little bit. Then you want to rub the palms of your hand together. And as you're doing this, then you want to rub between your fingers, doing your thumb first, both sides. You want to intertwine your fingers, rub them together. Normally you would be standing over the sink to do this actually. And then rub the back side of your hands. You need to make sure that you have this constant friction and motion for 20 seconds. And if you can't think of how long 20 to 30 seconds is, sing happy birthday 2 times through. And that'll get you to the point that you need to be. Make sure you cover every area of your hands. Also, the other time that you would want to make sure that you wash your hands as opposed to using foam is going to be if your hands are visibly soiled. If you have dirt on them, if you notice some blood on them or some type of drainage or something like that, make sure you use soap and water to wash your hands with that. And then you'll rinse. You want to make sure you get everything rinsed really well. The soaps can sometimes be irritating to the skin, so make sure you rinse it off well. You want to get your hand towel, pat dry your hands, go from the top down, and then use your paper towel to turn off the water. Just like that. And you've washed your hands. Now, the other thing is foaming. Like I said, you can foam 7 times between each hand wash. You just want to get a little dollop in your hand, and you want to do this the same way that you would do the soap. Foam is at the entrance and the exit of each patient room, by the elevators, in the hallways. Anywhere there's foam, if you think about it, just foam your hands. Rub your hands together. You want to do in between the creases again. You also want to get both thumbs. You want to get the outsides of your hands, rub them. And with foaming, you have to make sure that you actually let it dry. You don't want to be waving your hands around, letting it dry like that. You need to continue to rub until it actually dries. So, does anybody have any questions? Okay, thank you and have a good day.